Endometriosis takes place when tissue equivalent to the inside layer of the uterus is cultivated in the exterior of the uterus. This is specifically common along with women in their 30s and 40s, and it creates difficulties in conceiving a child. It has an effect on 11% of women between the age of 15 and 44. There are many endometriosis treatment methods that help in increasing the probability of pregnancy.
What is endometriosis? Table of contents. What is endometriosis? Common symptoms of endometriosis. Why do endometriosis cause pain and health problems? What causes endometriosis? How can I prevent endometriosis? Can I get pregnant if I have endometriosis? Impact of endometriosis on fertility. Endometriosis and fertility. Pregnancy and endometriosis. Endometriosis is often termed endo, and it is a general health issue in ladies. The name has derived from the word endometrium, a tissue that usually lines the womb. Endometriosis takes place when tissue adjacent to the lining of the womb grows outer surface of the uterus and other portions of your body where it is not connected.
Common symptoms of endometriosis include digestive problems. This comprises constipation, diarrhea, nausea, or bloating, specifically at the time of the menstrual cycle. Infertility, not capable of conceiving a child. Spotting or bleeding at the time of the menstrual cycle. However, this can happen because of endometriosis or other reasons. If this happens continuously, you should consult your doctor. Pain at the time of the menstrual cycle when urinating, and in the rare case, you might detect bleeding in urine or stool. Chronic pain in the pelvis and lower back. Pain at the time or after sexual intercourse, and this is commonly explained as a deep pain, and it is different from pain during the penetration.
Intestinal pain. Why do endometriosis cause pain and health problems? Endometriosis growths are slightly gentle, not hazardous, however. You should not neglect them. It can still cause health issues. Endometriosis growths might bleed and swell up similarly. The lining into your uterus takes place every month during the menstrual period. This can result in pain and swelling because the tissue enlarges and bleeds in a part where it cannot release from your body. If the precaution and treatment is not done on time, the growth might continue to spread and result in health issues like inflammation, troubles in your bladder and intestines, and risk of adhesions, tissue that can connect your organs jointly. This scar tissue is responsible for infertility and pelvic pain. It will block fallopian tubes when growth happens inside the ovaries. Blood gathered in the ovaries can produce cysts.
What causes endometriosis? Well, there is no specific cause of this disease. However, there have been several types of research going on to determine the reasons. A problem in the immune system turmoil, and various cancers are common in ladies with endometriosis. An immune system disorder might not succeed in detecting and eliminating endometrial tissue growing on the outer surface of the uterus. Disturbance with the menstrual period flow. Conservative menstrual flow is the most common reason for endometriosis. Some of the tissue tends to move at the time of menstrual flows via the fallopian tube into other parts of the body, like the pelvis. Surgery. During surgeries to the stomach area, such as hysterectomy or cesarean C-section, endometrial tissue could be pulled out and stimulated by mistake. For example, endometrial tissue has been found in abdominal scars. Hormones. The hormone estrogen appears to develop endometriosis. Studies are ongoing to see whether endometriosis is linked to issues with the body's hormone system.
How can I prevent endometriosis? It is not easy to eliminate endometriosis completely, but you can decrease the possibility of increasing it by reducing the levels of the hormone estrogen in your body. Estrogen helps in thickening the lining of your womb during the menstrual period. You can reduce estrogen levels in your body in the following ways. Don't consume alcohol in large amounts. In fact, we recommend quitting alcohol consumption altogether. Alcohol increases estrogen levels. If possible, not more than 1 drink is recommended for women who are habitual drinkers. Daily exercise, more than 4 hours a week. Daily exercise is essential. It helps in reducing fat. A low-fat and fit body helps in reducing the quantity of estrogen flowing through the body. Don't consume too many drinks with caffeine. Research shows that consuming more than one caffeine drink in a day increases estrogen levels. Consult your surgeon about hormonal birth control solutions such as patches, pills, or rings with a small amount of estrogen. Can I get pregnant if I have endometriosis?
Yes, several women who have endometriosis can get pregnant, but it might be difficult to conceive a child. Scientists tell us that endometriosis might affect every 2 women with infertile cases, but there is no accurate information about endometriosis causing infertility. However, here are some common reasons. The immune system, which normally helps safeguard the body from disease, assaults the embryo. The endometrium, the surface of the uterus lining where implantation occurs, doesn't grow as it must. Scars of endometriosis block off or modify the form of the pelvis and reproductive organs. This can make it difficult for the sperm to detect the egg. A patient who has endometriosis and is having a problem conceiving a baby should consult a doctor. The patient should ask for treatment such as surgery to eliminate the endometrial growths.
The impact of endometriosis on fertility. The irritation and inflammation that occur due to endometriosis can distress infertility. Inflammation of fimbria, which carries the egg and distributes it into the fallopian tube, results in scarring and swelling so the egg might not reach its targeted place. Moreover, the inflammation badly affects eggs and sperm when they are exposed to the unfriendly surroundings due to endometriosis. In many cases, endometriosis begins to result in adhesions, and the pelvic organs become fixed to each other, which eventually reduces function. Endometriosis also blocks the fallopian tubes. Often, this endometrial tissue circulates to the finishing point of the fallopian tube inside the abdomen. In a few women, this tissue will connect to other organs. The hormones formed in the next menstrual period attract this additional tissue to develop and later on shed, such as tissue in the uterus. However, this tissue detaching and bleeding has no option to go out of the body, which causes irritation and inflammation of local tissue. Normally, the inflammation results in the pain that patients frequently experience with endometriosis.
Luckily, pregnancy essentially improves endometriosis. The hormones obtained cause most of the endometriosis to resolve, so the doctor tries to help ladies get pregnant before treating with laparoscopy. When endometriosis is so severe that conception doesn't take place, then laparoscopy is essential. After treatment, the best chances of pregnancy are in the first couple of months following the procedure. Your surgeon can perform surgery to prevent endometriosis from reforming. Breastfeeding reduces the growth of endometriosis, as do birth control tablets. Once the patient completes breastfeeding, we suggest beginning birth control tablets until she wants to get pregnant. This treatment will provide a fair possibility of pregnancy without performing laparoscopy again or any other infertility treatment.